And what are the risks of injecting methadone and buprenorphine?
Both buprenorphine and methadone are pharmacotherapies that are oral medications that are used in the treatment of drug dependence. These medications have been designed to be taken orally and not to be injected intravenously. So there are a range of risks associated with injecting these medications. At the local level, there's a risk that it may damage the vein. The vein may block and may also cause damage to surrounding tissues. That increases the risk of infection in those tissues. You can also develop ulcers. And when a vein blocks, or thrombosis is formed, and that can also then have other sorts of serious problems. As well as the risk of infection around the tissues where the person injects, there's also the risk that the blood may become infected. That's called septicemia, and when a person develops septicemia, there's also the risk that the heart valves can become infected and the heart may in fact fail. Septicemia and heart failure can both be fatal. When a person's veins start to block, progressively it becomes more difficult to find veins that can be injected into. In that situation, there's a risk that the person may then inadvertently inject into an artery. If you inject into an artery, the risk is then that it may actually block the supply of the blood that is so vital that artery provides to the limbs, such as in the case of if you inject in the arm and block an artery there, it means that the blood supply to the hand is blocked. That can cause gangrene, and if that's not successfully treated, that can ultimately require the amputation of a person's hand or even an arm. In the case when a person injects in the groin, the risk can be that eventually a foot or a leg can have to be amputated. These are all potentially life-threatening conditions. Any drug, when it's injected as opposed to used in other sorts of ways, increases your risk of drug overdose. Withdrawal symptoms that a person might get after injecting buprenorphine are like those that are often colloquially referred to as cold turkey. So the person feels very anxious, very sweaty, very irritable, have difficulty sleeping, can also feel nauseated or develop diarrhea. As far as reducing the risks associated with methadone and buprenorphine, injecting, of course, the first thing to consider is not injecting these medications. Particularly if you are in a treatment program, you really need to be thinking about what your treatment goals are. And if you're injecting these medications that are being prescribed for you, then maybe you need to rethink the appropriateness of that. On the other hand, if they're prescribed for other people, of course, there are great dangers in using medication that has not been prescribed for you, for which you're probably not tolerant, and could result in serious, sometimes potentially fatal outcomes, particularly drug overdose.